Hello friends, I am Dr. Krishnapriya, a dentist from India, currently working as a dental therapist in UK. In my last video, I gave a brief description regarding how to use Exact SOE dental software used in UK dental practices. There are other softwares like Dentally, Dentix, etc. which are used in several other practices. Those can be used with ease if you have a basic knowledge regarding how to use the Exact SOE dental software, which was demonstrated by me in the last video. So today I am coming with a new content. I know a large number of therapists and hygienists got their registration recently, and many of them are yet to get their registration. Most of you might be actively applying for jobs and attending interviews. I too had gone through the same phase and attended interviews both online and offline. So in this video, I would like to share my experience regarding attending the interviews and the questions the interviewers focused on. So to begin with, first there are two parts in an interview. The first one is just basic questions like give a brief introduction about yourselves. Would you be able to work full-time or part-time? Would you be able to work as employed or self-employed? And the basic difference between the employed and self-employed is, in employed, you will be working on hourly basis and your tax will be deducted from them. And when you work as self-employed, you work on a UDA basis and you have to pay your tax by your own. Also, there are therapists who work under direct access. In direct access, you can see the patients directly, take x-rays, arrive into a diagnosis, start a treatment plan, and can do treatments which are under your scope of practice and refer the other treatments to the dentist. The other one is you work without direct access. That means the dentist sees the patients first and start a course of treatment where you are supposed to do only the treatments as directed by the dentist. So here you can do the referred treatments only. Certain practices prefer therapists to work under direct access, whereas others do not. Coming to the second and main part of the interview is the theory and clinical questions. The first thing you need to know is, of course, your scope of practice, of which role you applied for, whether it is therapist or hygienist. The scope of practice means what procedures you can perform as a therapist or hygienist, which is given in detail in GDC's website. You should have a thorough knowledge about the same. The next important thing to be aware of is what you cannot do as a therapist or hygienist. For example, as a therapist, you are not allowed to treat a patient in severe pain who will be directly seen and treated by a dentist. Similarly, a hygienist is not supposed to do fillings, extraction of primary teeth, etc. So, you must have a first-hand knowledge about what you can do and what you cannot do. Secondly, for interviews, you need to concentrate more on periodontics, since you will come across a lot of patients suffering from gum disease such as inflammation and bleeding of the gums while brushing the teeth. So, you need to know how to record a BPE, that is basic periodontal examination, and you should also have a first-hand knowledge about the 2017 classification of periodontal diseases, such as staging, grading, risk factors, etc. You also need to know how to do periodontal charting, that is 6-point pocket charting, and plaque as well as bleeding indices. You should also have a knowledge about the oral hygiene instructions, interdental cleaning aids, brushing techniques, etc. So coming to the third part, you should know all the procedures you are going to deliver to the patients, such as in case of therapist, you should know how to give infiltrations, block, PMPR, that is professional mechanical plaque removal, and each and every steps of the fillings, including GIC, amalgam and composite fillings, and extracting primary teeth, and last but not the least, all the post-operative instructions as well. Coming to the fourth part, certain interviewers do ask questions regarding the clinical scenario-based questions. For example, while you were removing the decay of a grossly carious tooth, accidentally you encountered a pulp exposure, what you would do at that time to save the tooth. Another example is, so when you do an extraction of a primary teeth, or sometimes the root may be dislodged, or sometimes the root may be broken, and there will be retained root in the socket of the tooth, and what you will do at that time immediately. So these are certain clinical scenario based questions which you will encounter when you practice in the dental clinic. So coming to the fifth part, you need to have a thorough knowledge about how to tackle medical emergencies, if any happen on your practice. And you need to update your immediate life support course on an annual basis. The sixth important point is you need to know is the NICE recall interval time periods. That is National Institute of Clinical Excellence, NICE recall time periods. That is especially when you work as a direct access dental therapist, because you should know when to recall a patient, if it is 3 months or is 6 months or 12 months or 9 months. So you should be aware of that. The seventh area of concern is some interviewers may ask you questions to dig out your extra skills and capabilities. For example, they may ask you questions like, elaborate a time period when you worked under pressure, are you able to work effectively in a team, or why they need to hire you over the experienced ones, etc. Like simple basic interview questions. So that's all about the preparation for interviews. There may be more questions, but I have listed almost all of them which I know. In addition, you need to work yourselves and do a proper homework before attending any interview. So all the best for all the therapists and hygienists searching for jobs. In my next video, I would definitely share some knowledge regarding the new provisional registration for overseas dentists to work as dentists in UK without any exams. So please feel free to like, comment, share and subscribe my YouTube channel. I'll be back with new interesting videos. Thank you.